Welcome to Afrik InnovScience, where we celebrate the brilliant minds shaping the future of science, technology, and engineering in Africa. Today, we have a remarkable guest with us, Olive Thomas, a medical laboratory scientist, an aspiring clinical research scientist from Harare, Zimbabwe. Olive's dedication to medical research and her commitment to advancing healthcare in Africa is truly inspiring. Let's dive into her journey and insights. Good evening, Olive Thomas. Thank you very much to be with us today on Afrik InnovScience. Please, can you introduce yourself like that for the people who don't know you?
Thank you very much, Patrick. First and foremost, I want to thank you for the work that you're doing. I mean, we would not be able to share these ideas if you had not created this platform. So all thanks to you for bringing this initiative up and having us to discuss about this and have others, get to know about ideas. So first and foremost, Olive is a young girl from Zimbabwe, Harare. I grew up in a local community called Chitungisa. It's more like a ghetto, if there is a word like that in Europe. But professionally, I am a medical laboratory scientist. But out of passion, I love doing public health education works, awareness programs, and advocacy. And I aspire to be a clinical research scientist as a way to advance my work from being a medical laboratory scientist, because the field is very broad. Being a lab scientist is broad. You can go into diagnostics, but you still have questions that need to be answered as you're doing your work. So I think all of that has led me to want to do clinical research, and that is why I aspire to be a clinical research scientist.
Oh, it's fascinating to hear about your journey. Now, let's delve deeper into your career path. Olive, can you share your journey in the field of medical laboratory science from your education at Africa University to your current position as a fully registered medical laboratory scientist?
Yeah, thank you, Patrick. That one is it's a funny journey that I've heard from becoming a medical lab scientist. So, you know how we as kids, we are asked often what we want to do when we grow up, and mostly we talk about being a doctor, being an engineer, being an accountant, etc., and all of those other professions. And I think that has come because of lack of proper career guidance to schools for children to know what other avenues and professions they can have. So I never dreamt of becoming a medical lab scientist at one point in my life. But because of circumstances, I would say there's a procedure that is used here in Zimbabwe where you have to attain certain points at advanced level for you to then get into medicine. So initially I wanted to do medicine, but even prior to wanting to do medicine, I wanted to be a lawyer. Funny enough. Then I changed to want to do medicine because I realized I was so good in chemistry, and I loved chemistry. I loved physics. I just loved STEM subjects. And when you're so good in STEM subjects, one profession that would just come to your mind is being a doctor, being an engineer. So I wanted to be a doctor, but I couldn't attain the adequate points that were needed to become one. So I remember I even had to take a gap year trying to think, what exactly can I do, now that I cannot enroll to do medicine. I know there could have been other avenues to go outside and do all of that, but I didn't fancy all of that. So I had to take a gap year to try, go back to the drawing board, go back to the vision board and see what other avenues I could try within the medical field, because that is where my interest and passion lied. So after through all the search, that's when I bumped into medical lab sciences. So I remember my mom even applied for me for that program. And when I got then admission, she just told me, you are going to Africa University to do medical lab science. I'm like, okay, what is that? What is that even? And I got to learn about this program when I started it. It's different from wanting to do medicine and then you're thinking, when I become a doctor, I'll do this and do that. But when I had to go and do medical lab science, it was a different thing altogether, because I had to start to learn about the program. From the first day, you're sitting in class and the lecturer is asking you, what do you know about this program? What do you want to do in the next 5 years? How can you know what you want to do in the next 5 years when you don't even know what it is all about in the first place? So it was all about, finding out and researching about what the program was all about. And I think the journey had that is what made the journey interesting, because there were so many eureka moments for me. You would realize, oh, okay, so as a lab scientist, I can actually do this. So I diagnose. So I am the one who helps doctors to know what is wrong with the patient. Oh, wow, so I actually do great work. And that has been a very interesting journey for me. And it has brought a lot of opportunities that I did know. And I think when I look back now, I'm appreciative of all I had to go through that journey, because it just wasn't straightforward. It wasn't anything I expected, but it became more interesting because I found out things I didn't know I would find out. So I started my degree in 2018, then finished in 2022 from Africa University. Then immediately, I didn't even have to look for a job, because medical lab sciences are in high demand in our country. I don't know about other African countries, but they are in high demand in our country. So immediately when you finish your degree, you're getting a job. So I got a job, but still, when I, secured my job, I then realized, okay, I might have wanted to do lab sciences in the diagnostics field, but I also have mentors, that have gone through this journey but are now doing something different, and that is clinical research. And that is how I landed to where I am now, to want to think, okay, I can actually leverage on my skills as a lab scientist to do clinical research.
Mm-hmm. You have mentioned an inspiration, an aspiration to become a clinical research scientist, focusing on chemical and molecular diagnosis for infectious disease and cancer, right?
Mm-hmm.
Will you tell us more about your specific interests and goals in this area?
So yeah, wonderful. Here back in Africa, there are so many efforts that are being done is to eradicate diseases and to educate the public about their health and the public health and everything that's happening. That is great. That is awesome. But I think we are lagging behind as far as including non-communicable diseases concerned, because you're more concerned on eradicating malaria, HIV, TB, all of those infectious diseases, communicable diseases, which I think is okay, but we have gotten to neglect the non-communicable diseases such as cancer. We think they are diseases for the whites, or I don't know, for other continents that do not affect us, but we are losing so many people. And because of that, that is one of the things that then led me to want to get into that space, into that area, because we cannot wait for any other generation to do it for us. We are the people that are there. We are the scientists, the current scientists here. And we have to pave that way to start talking about cancer, to start talking about research in cancer. So my specific goals and interests are lying towards that trajectory, because I want, we as African countries to be more versed and more aware about cancer illnesses. And even so, to not just wait for Western countries to then produce vaccines for us. Right now, we have the HPV vaccine, but we might have those vaccines here in Africa, and the research might have been done here, but the vaccines were produced outside. That does not make sense to me, because we are not making use of solutions that to the problems that actually affect us. We are not bringing solutions to the problems that actually affect us. So I think we need to bring that back home and start to actually study the problems that affect us as Africans and produce solutions that are in line with the problems that actually affect us. So I want to be known as the woman who advanced cancer research and advanced vaccine development in cancer from Africa.
Olive, how do you envision leveraging your skills and knowledge to contribute to advancements and innovations in medical diagnostics, especially in the context of Africa's healthcare system?
Yeah, so the beauty about being a medical lab scientist is broad. That field is super broad, and you get to learn about different expertise and knowledge, because we cover microbiology, we cover virology, we cover biochemistry, we cover hematology. All of those aspects, they are so important as far as, you know, getting to know about diseases, as far as all of that is concerned. So I think me being a scientist has already put me at a winning position to use all the skills that I've gained through the diagnostic field. Because once you start diagnosing, remember, we are running patient samples to try and find out what is wrong with them. Once you then realize that, okay, I've gotten these absurd results, your next thing is you're thinking, how did this happen? How did we get here? So all of those things, they then brew research skills in you, you know, questioning everything that happens. And when you start questioning, you're already researching, because that's where it starts. It starts from realizing problems and trying to find answers to those problems. So I think the field of lab diagnostics has given me and has acquainted me with the necessary skills that I would need to pursue clinical research sciences.
Thank you very much for this. And based on your experience, what challenges do you think the healthcare and medical research sector face in Africa? And how do you think these challenges can be addressed or mitigated?
So without beating around the bush, to be honest, I think the major problem is in financing and funding. Yes, we might try to find other problems, but the biggest problem is financing, because for everything to work well, it needs money. And we as Africans, half the time we are waiting for the Western world to fund us. You know, I've heard at one point when I was talking to my mentor and we were talking about this thing, I was saying, I know we have so many programs that have got to do with HIV, so many programs working to find cure against TB. That is awesome, but we have very few programs that are, you know, targeting cancer. Why is that? And my mentor told me, even most scientists, they are deciding to leave their passions and go to where there is money, because they know most Western countries, they fund HIV, they fund TB, right? So we are losing so many skills, so many bright minds that we could have used to, you know, research more about cancer. Why? Because they know if I go to infectious diseases, that's where funding is. So I think if we are able to invest more in our healthcare systems, despite of us relying on the Western funding, that would be great. And one would ask, how? I mean, we can increase, I mean, the governments, if we are able to engage with our governments so that they increase their budgets as far as the healthcare system is concerned. Because once we have a functional healthcare system, the economy is boosted, because we have a healthy nation, we have a healthy, able-bodied people who are able to, you know, bring in their skills and expertise into the space for us to grow. So I think the major problem in funding, firstly, and also secondly, the attitude from us as healthcare personnel, our attitude toward improving the healthcare system. Because firstly, we need to be intentional. It's not just you trying to sound fancy that I am a doctor, I am a neurosurgeon, or I'm a scientist. You need to be intentional about the work that you're doing. And I think that's how we'll be able to, you know, use the skills and the knowledge that we have to make sure that we have a growing healthcare system.
Olive, now let's talk about the foundation Women Healing Foundation. It is focused on women's health education and advocacy. You are involved in this foundation. And how important is community involvement for you? And how do you see science and technology impacting community health in Zimbabwe and beyond?
Thank you so much. I think one thing that is very close to my heart is community involvement. So it wasn't really straightforward for me to have started this organization because I was just thinking maybe it's not necessary, maybe I shouldn't. But because of that drive of wanting to involve myself with the community led me to want to do that. And like I said, I'm a public health education enthusiast. I love, doing awareness programs, teaching people. And for us to be able, sometimes we just assume that people know things. We just assume that people know that if you don't wash your hands, you get cholera. We assume because we are in the medical field already. But you would realize that for the most part, even in rural parts, if we come back to Africa, in the rural parts, they might not even have that knowledge. So that's where we begin, getting into the community, educating them, making them aware of the dangers of certain public health behaviors, risk behaviors that they may be undertaking, which may be risky to their health. So I find that really engaging, to be with the people. And when you're working with the community, you are understanding their issues, and when you then have solutions, they are how can I say, they have the customer empathy. You're following the customer empathy, or I can say the patient empathy map. You're bringing solutions to the problems that people are actually facing. It's different from when we just sit in our rooms, we sit in our labs, and we're thinking, okay, I think people need this. I think we have a pandemic, but people need this. But no, what if we get into the communities, engage with the people themselves, hear the stories, hear the problems that they are facing, what actually is happening in the community? So I love that because I love hearing from the people. And community involvement for me is, as far as science and technology is involved, I think, like we mentioned earlier, technology has brought a lot of advantages to us. We can communicate across continents globally. We can have, this the relay of information even across borders. And that is one of the great contributions that technology has done for us, to be able to engage even with people who are not where we are. So it doesn't necessarily mean that if you're going to involve yourself in communities, you have to travel miles to go there. You can set up a Zoom meeting. We have had webinars. We have listened to webinars from people in India, from people in different parts of the world. That is how we are getting the information. So I think technology has done a greater part, and we continue to, encourage that innovation in the space of technology to involve and engage with people in different communities. And I also would want to even encourage people who are in the healthcare system, to leverage on the technology advancement that is happening. AI, a lot is happening in the technological space. We must not be left behind as the healthcare system. We must leverage on all of those developments and be able to use that. And I love that recently, even there was an Africa Health Summit by Africa CDC. It was the first of its kind, I think. They've started to then incorporate the digital space. Whenever we have conversations about bringing solutions to the healthcare system, we must include the digital space. We must include technology because it forms a greater part. We are able to disseminate information faster. People are able to access information wherever they are, from all parts of the world.
Given your involvement in mentoring and teaching, how do you think education and mentorship play a role in nurturing the next generation of scientists and researchers in Africa?
Yeah, great. There's a saying that says, if I've seen feather, it's by standing on the shoulders of giants. Mm-hmm. And that completely summarizes all you need as a young person, to grow. And I, for one, from my personal experience, I've heard to know about different opportunities. I've heard to know about different avenues that I can take as a scientist by looking up to certain people. I have different mentors in different spaces, which which encourage us, honestly. And they say also that you cannot become what you haven't seen before. So having that idea of mentorship, someone to look up to, someone to direct you and lead you, because remember, the space that you're trying to get into, you probably have never been there. You've never been 27 years old. It's your first time being 27. You've probably never been a research scientist. It's your first time being a research scientist. So you need someone who has walked that path. You need someone who has gone through the difficulties, the challenges, to then hold your hand and direct you on that path. So I think mentorship is a very, very, very fundamental part as far as professional development, career development, and even in the sciences field. As long as all of that is concerned, mentorship is really important.
Wow, thank you very much for your words, Olive. Mentorship is really important to show the path to the next generation. The next generation must have mentors to be sure that they are taking the right direction. Thank you very much. Lastly, Olive, what would be your final words of inspiration or advice for aspiring medical laboratory scientists and researchers, especially those in Africa, before we conclude this interview?
Network. I cannot stress further on this. I think it's the work that is done in collaboration, it's intense and it brings effective results. I, for one, I regret the time I wasted when I was still in university and didn't have to network. I was just worried about my grades. Did I have an A? Did I have that A plus? And not actually, engaging with other people and forming networks. I could have gone to the people doing IT. I could have gone to the people doing international relations, share ideas with them, about the problems that we have even in our healthcare system, and how we can improve that. You'd be surprised that there's so many ideas that they have to offer. So I would encourage aspiring medical lab sciences students for them to network with people. Even it doesn't necessarily have to be your field, even in other sectors, other departments. Network as much as you can, because that is how you're going to find opportunities. Right now in the space that we're in, I do not want to lie to you, there are so many opportunities that are being presented to young people, so many of them, but you might miss most of them because you're not engaging with others. So make sure you have other people that you talk to, make sure you have other people that you're engaging with, so that you also even increase the spectrum of opportunities that you're going to have. Because you just don't want to have that degree and sit at home or work on the bench for the rest of your lives. No, we need you to have impact. All of us has to have an impact, has to leave a mark here, and we have to make use of our connections and all of that. And lastly, never be afraid to knock on doors. If you have that idea and you think the Minister of Health wants to hear this idea, don't be afraid to knock on that door. We tend to be afraid of certain professors, even in university. No, don't be afraid to knock on those doors. Go to those doors and present whatever it is that you have, because I think once we become open to knock on any door, that brings an area of opportunities for us as young people.
Thank you, Olive, for sharing your incredible journey, insights, and aspirations with us. Your dedication to advancing healthcare and research in Africa is truly commendable. Thank you very much.
Thank you so much, Patrick, and I'll applaud you once again for creating this space. I can't wait to hear more other speakers who are going to come in line with this, to hear about the work that they're doing in the healthcare field.
Thank you, Oli. For sure, we stay connected. We are going to organize webinars or live sessions on Afrik InnovScience so that you guys will share with our viewers all your your experiences and answer their questions if possible. Thank you very much once more.
Thank you, Patrick.
To our viewers, if you enjoyed this interview, don't forget to like, share, and subscribe for more inspiring stories from Afrik InnovScience. Until next time, stay curious, stay innovative, and keep pushing the boundaries of science and technology in Africa. Goodbye.